Hello, my name is Alejandra Hurtado Taranto, and today I'm going to talk about rhinofacial entomophthoromycosis, also well known as zygomycosis or mucormycosis. Definition: this is a rare, fungal, severe, and lethal disease with rapid progress. This disease is prominent in countries with warm and humid climate, like Brazil. There is an important international tendency, mainly in immunocompromised patients. For example, in Japan and in the United States, there have been reported 2 and 4% of cases, mainly in patients with cancer. The diagnosis of this disease is based on a combination between two types of tests, mycologic and histopathological. The most common symptoms are nasal congestion, nasal discharge, and chronic sinusitis, but patients may also present fever, lethargy, proptosis, retroorbital pain, and seizures.
Zygomycosis in the immunocompromised patient. Another common form of disease is characterized by contamination of traumatic or surgical wounds with spores, resulting in local infection and occasional dissemination in immunocompromised hosts, such as critically ill patients. One of the most severe forms of the disease occurs in profoundly immunocompromised patients, such as transplant recipients or patients with cancer, where the spores are inhaled, causing a local necrotizing infection in the lung, with subsequent dissemination. This form of the disease is almost always fatal.
Applications in medicine. Clinical and experimental data clearly demonstrate that individuals who lack phagocytes or have impaired phagocytic function are at higher risk of rhinofacial entomophthoromycosis. How does this work? In normal people, the spores that reach the respiratory tract adhere itself to the nasal mucus. If there is a wound in the mucous membranes, polymorphonuclear neutrophils phagocytose and destroy the fungal structures in a few minutes. But in descompensated diabetics, the mucous membranes are so dry, so the spores remain in the tissue. Studies have also shown that ketone bodies help the development of these agents.
So who's at risk for infections due to these common environmental molds? And why did this diabetic patient with no other immunocompromising features develop this life-threatening infection? Clinicians have long noted that mucormycosis tends to occur in patients with profound deficiencies in immunity, especially those with prolonged defects in neutrophil function, such as patients receiving high-dose chemotherapy for various cancers or hematopoietic stem cell transplantations. This is similar to the risk factors for infections due to other molds, such as Aspergillus species. However, mucormycosis also occurs in diabetic patients with frequent episodes of DKA, as well as in patients with iron overload syndromes, such as hemochromatosis. In these syndromes, there is an excess deposition of iron in the tissues. Now, recently, investigators have discovered that iron availability is an essential component to the pathogenesis of mucormycosis and other infectious diseases. Typically, the host tries to sequester iron away from invading microorganisms using high-affinity iron-binding proteins. This system offers a nonspecific barrier, preventing many microorganisms from being able to grow in the effectively iron-starved environment of the host. However, iron is more available to the microbes in the context of the acidic state of DKA or in metabolic conditions resulting in high tissue iron levels.
Pros and cons. Pros. A correct diagnosis will take to an effective medical and surgical interventions to manage patients with entomophthoromycosis. Antifungal therapy and surgical management indefinitely decrease the likelihood of death. Cons. Rhinofacial zygomycosis carries a mortality rate of approximately 85%. Mortality rates are very high because by the time zygomycosis is suspected and diagnosed, it has frequently spread diffusely and caused extensive tissue destruction.
Important. Clinically, many of the manifestations of mucormycosis relate to vascular invasion. We often see necrotic tissue in the lungs of patients with pulmonary mucormycosis. Additionally, there's poorly viable tissue in the sinuses and other involved structures in rhinocerebral disease. Now, oftentimes, these poorly viable tissues must be surgically removed because they display decreased antibiotic penetration and decreased penetration of the immune cells. Decreased blood flow results not only in frank infarction and death of tissue, but also local tissue hypoxia in the surrounding regions. So the importance of hypoxia in the pathogenesis of infections is an area of acute investigation.
Issue applied in Ecuador. According to the latest epidemiologic surveys, approximately 2/3 of all zygomycosis cases occur in males. In our country, only patients with HIV/AIDS, cancer, and transplanted were identified, demonstrating that 3% of the Ecuadorian population may have or may be affected by an opportunistic fungal infection as zygomycosis.
Spread. Overall, the mortality is between 30 and 70%, so that's a pretty lethal infection. And that's despite improvement in drugs and an understanding of the disease and better surgery. There's quite an interesting study from Mexico which has looked at the epidemiology, and you can see overall that there's been a rise in the number of cases documented, and that's particularly associated with diabetes, but also associated with malignancy. And of those cases, 72% were diabetic, and the patients with sinusitis as the cause of the location of the disease was also found in about 75% of patients, and half the patients died.
Conclusions. The rhinofacial entomophthoromycosis is a severe fungal disease that can affect both immunocompetent and immunocompromised individuals. The literature shows that rapid diagnosis and early adequate treatment are fundamental for the disease prognosis.
So in summary, this is an uncommon, aggressive, necrotizing infection. It probably affects more than 10,000 people, but it's pretty rare in many, many countries. Cerebral or rhinocerebral orbital mucormycosis is the commonest form of this disease. Radical surgery, antifungal therapy, correction of the underlying metabolic or immunological defects are very important. Some patients have other infections which need to be controlled. And survival's a little better if you have cutaneous disease, but it's pretty bad if you have disseminated disease. Many thanks.
Thank you for your attention.